Liposuction is basically typically the surgical removal of fat through a suction device of one type or another. It's historically started with just a simple vacuum sucking of fat, and it has evolved into a relatively sophisticated procedure now where we basically ultrasonically break up the fat with first, and then we aspirate the fat out. Can be done pretty much everywhere on the body nowadays, but it is basically just the surgical removal of fat at its root. What I'd say first is that liposuction is surgery. Don't forget that some people tend to try and minimize it and say that it's, oh, I'm just going in and having a little liposuction done. It is surgery, and with all the regular risks that go along with surgery in terms of infection, bleeding, anesthetic risks. Again, all very minor numbers, but they are real. The real things that are specific to liposuction typically are that the areas are all pretty numb for quite a while afterwards, so a person has to be aware that wherever we remove fat from, it's just going to feel different for a while, probably 9 months, a year. And then the other thing that is that you don't want to overdo liposuction. The general tendency on patients is to say, just suck it all out. I've got this fat here and I want you to take it all. And that's the worst thing you can do. You want to just be relatively conservative in what you remove, take down just the extra contour irregularities that the patient has and make them even. Overdoing it, taking too much, is a real problem and would require a real procedure to make it look better in the long time. Liposuction is one of the most popular procedures because it has such a good track record that in general, if the patient's a good candidate for it, is living a healthy lifestyle, has relatively modest areas to be removed, you can very confidently bring those areas down. It's really my job during the consultation to give the patient a realistic expectation of what can be achieved and not achieved, but if the patient's a good candidate for it, the success rate is very high.